Good afternoon, everybody. Today is May 20th, 2022. I'm Scott McGann with the Falmouth Health Department doing our weekly COVID-19 update. Our email is health@falmouthma.gov. Our phone number is 508-495-7485. So where are we this week? So we're at 4,638 PCR positive tests, which is about 103 cases for the week. 122 last week, 14 probable, 18 probable last week. Our incidence rate is up from 39.4 to 48.10. What incidence rate per 100,000 means is per 100,000 population is 48 daily cases. If we had a population, adjust all the populations equally to make so you can compare town to town, municipality to municipality. And our percent positivity jumped from 8.82 to 10.15. That would capture, if you see my cursor, the previous 2 weeks, because of the when the state does it, it's the 1st to the 14th, and we're a week past that. But that's how they do it, and so you're capturing this high week of 122 and the week we had that was somewhere like 80-ish, and you put them together, and that's our positivity up. This week is a bit lower. Hopefully, it's a trend. You can see these ebb and flow and peaks and valleys that we get. With increases in cases. So we had 1, 2, 3, 4, 5 increases, six increases actually in a row, and this is our first drop. So hopefully that's something that we're going to continue with. I don't know. It did seem to be tailing off towards the end of this week. Hopefully it continues, and this is sort of where we were for the spike. Now, in terms of cases, remember, these are confirmed cases. So starting in January, right around that big Omicron surge, the number of home tests are going to outnumber the number of PCR. People are going to go gear towards the home test. So these numbers aren't all that accurate. They're actually much higher. I would estimate, based on what I can tell here at town, with places like schools and long-term care and things of that nature posting, the schools are a good indicator because people do report positive home tests on children to the schools to let the schools know the child will be out. And if you look at that and you look at how many of those were confirmed or confirmed cases versus the total number, because that'll add in the home kits, it's somewhere around 2.3 to 2.5. There's been some studies that say it's somewhere around 2.5 to 3.5. So I think with what I kind of gather is it being about 2.5 to 3 times more actual cases, with adding in the home kits than there would with PCR. So that was been true back in January when we had this big spike. You see, 375. That could have been a week of 1,000 cases, somewhere in there, 900,000. And you see a week where we have 100, roughly, cases. That might have been 250 to 300 this week. So that's kind of a ballpark. It may not be accurate. It's just the best I can tell. It's sort of a guesstimate on the actual true case count when adding in home kits, because most people are gearing towards the home kits. So that being said, if you look at this chart here, the closer the dots are and the more it is flat, the better we're doing. So we're not spaced out quite that way. We're having huge jumps week to week in case counts. But we did have an upward trend. You can see that at the end it's gearing towards upward. So you want, again, hopefully this gets flattened out as we start getting into the summer season. And we'll find that out. But again, I focused this on my last few. What is really important is not case counts right now. The vast majority of people are doing fine if they've been vaxxed and boosted, with some, a few exceptions, but it's about the severity of the disease. So this is something from the CDC that determines whether you're low, medium, or high. The whole region, pretty much most of the state, New England in the Northeast is more on the medium to high. If you look at this on the CDC's website. And what determines high is a case rate over 200 per 100,000 population. Okay, so we're at 344. So we're well above 200 at 344. COVID admissions per 100,000 is at 14.1, and you'd have to be less than 10 to stay in the medium. But our percent staffed inpatient beds used by patients with COVID-19 is 4.4. So that's well below. So that means that the hospitals are having cases, not to the point where they're stressing the healthcare system. When you have high case counts, you're generally going to have more hospitalizations. It's not to the same extent that you would see hospitalizations, let's say in these charts, that show January of 2021 being the part where we had the highest burden on the hospitals, and again on January of 2022. And one was mainly because we still just didn't have the vaccine in everybody yet. And even though our case counts might have been 100, we were having these high numbers, even with a total case count of 100. And those case counts were very accurate because they were, only way to find out would have been something I was able to track because there were no home kits. These numbers were accurate in terms of hospitalizations, because hospitalizations are accurate because you're in the hospital for it. It's not a home kit where you got the sniffles or mild cold or a medium-sized cold and not showing on the radar. And this shows an equal number, even though the case counts were much higher. So your likelihood of going to the hospital in January 2022, if you had COVID, was actually less, even though the number of hospitalizations, just because of the sheer number of case counts. But looking over what we are now, you're not seeing it anywhere near what it was in January of 22 and January 21. So January 21 had a lower case burden. We had a lot of restrictions, masking, things were still remote and things of that nature. But if you did get COVID at that point, the likelihood of going to the hospital was a lot higher. Here, even though the hospitalizations were similar in numbers, the case counts were a lot higher. And where we are now is sort of in that medium range compared to that Omicron of 2022. Hopefully that made sense. So statewide, we're about 5,000 cases. Positivity is almost 10. 10 is a very high number. 14 deaths. Then death number would definitely have been higher with this case count prior to the vaccine. The vaccines definitely work, the boosters and so forth, and as does treatments like monoclonal antibodies and things of like Paxlovid. So it does tend to keep the deaths down. You still will have them because you have some people that are very, very frail in society, and those are the ones that this typically is going to give the most trouble to. And then again, hospitalizations is 866. And looking at the trends, it's still, everything's an upward trend again, but the deaths are lagging as a same indicator. Again, we have treatments and vaccines and so forth. But you're looking at things like cases. So our daily case count is a little bit of a down there, and maybe a little bit of flattening on testing positively. My guess is maybe we're flattening out from this more recent increase in cases. There is, like I said, an ebb and flow to it. And hopefully with all the vaccines and the treatments that it won't, spike up any further. This is the MWRA, so it's measuring the level of viral COVID virus in wastewater, and you can see we're nowhere near what we were in that the original Omicron surge. That was a ton of cases. We are not too dissimilar from the total case count that we saw in January of 2021. Now, the hospitals were in a lot worse shape then. Again, of course, it was Delta, which did seem to cause more of the lower respiratory pneumonia, and also we didn't have nearly anybody vaccinated. It was just getting started back then. Looking at it a little bit closer, if you just go from this year, and this is the southern region, so this would be the South Shore and the south side of Boston, it's not on a flatwood trend yet, so there is an increase. Maybe it might be, who knows. So we're sort of similar to that. It seems like we've got this more recent increase, and maybe in a couple of weeks you start seeing this line flattening, going down, I would hope, and we'll see. So I'll keep posting this as well in the presentation. Incidence rates amongst our peers here, amongst our neighbors, Falmouth was 48.1, the state was 51.2. Some of the towns fell higher, some fell lower. They kind of been bunched up until you get to the way out in the Outer Cape. The Outer Cape, less people. Also, I think they do more rapid testing, at least originally in the pandemic. They do more rapid than they do confirmed. Again, these are all based on confirmed PCR. But that's our incidence rates, and they're all high. Same thing with percent positivity. Again, you'd like to see it less than, I would like to see it between 2, under 2 would be great, 3 would be okay. You start getting over 5, it's definitely out there growing, reproducing rapidly and getting to a lot of people. We're at 10.1, so that's a high number for us. Again, probably, let's see, the average for the state was 8.11. We fall somewhere in the middle of the rest, of the Upper Cape and Outer Cape. Kind of, if you look at the colors, we're similar. Higher in sort of that Mid-Cape area. Their positivity is higher, like Eastham, Orleans, and Yarmouth. But they're sort of, we're all kind of bunched up similarly right now. As far as how fully vaccinated individuals, this is a pretty stagnant chart. I mean, there's some cases, there's breakthrough. The difference between 1 week to the next was about 20,000 breakthrough cases. And of those 20,000, it looks somewhere around 230 or 40 went to the hospital out of the 20,000. And the deaths were somewhere around 45 out of that 20,000. So that 1.61 means out of all the breakthrough cases, 1.61% of people get hospitalized with COVID if they've been vaxxed, and 0.52 deaths. So 2,861 people have died of the 549,138. Percentage of all fully vaccinated individuals that have gotten COVID, breakthrough, 10%. Of all the vaccinated people, including those that haven't gotten COVID, the hospitalization among all vaccinated people is 0.17%, and the death rate among all vaccinated people is 0.05. So that hasn't changed all that much percentage-wise. It's still vaccines, boosters, then treatment. If you do get COVID through breakthrough, are all going to keep the vast majority of us out of serious danger, again, based on your individual health status. Booster doses, again, nothing's changed on booster doses. 50 or older may get a second booster at least 4 months after their first. And then based on your age, with certain medical conditions, you also could be eligible for a second booster. You can mix and match. So if you had 3 Pfizers, absolutely nothing wrong with getting a Moderna. It might actually make sense. There's some different things you can read on that if you want to Google it before you schedule it. As far as scheduling doses, I find them same day, next day. Next day is probably a pretty good bet. I've seen plenty of openings at the pharmacies. So if you go on vaxfinder.mass.gov, there's been plenty of openings. We check it once a week. I got my second booster this week. It was the next day. It was in and out real quick. So that's something that you could definitely do if you're considering it. And that would be true if you're considering vaccinations for the first time. You've never gotten your second dose, never gotten a booster. Vaxfinder.mass.gov can take care of all that. It doesn't take more than 5-10 minutes to get registered. If you go on a pharmacy's website, they'll want your insurance information, so you don't have to give it when you get there. It's pretty seamless. It's not quite as difficult as it was when we first started trying to get vaccinating. Testing, most people are using the home kits, but Falmouth Hospital still has the testing, as does Convenient MD and pharmacies. They're still testing. You can also find that on the state's site as well, but testing is readily available. There's no delays in testing. Vaccinations, we only gained about 100 doses over this week, so not a lot of uptake. I think we're starting at, we're at that point where we're only going to gain very small amounts for first doses and second doses. And most of it will be boosters, though we didn't gain a lot of boosters over the last week, so maybe hitting saturation for boosters, I'm not sure. But, it's there if you want it, so take advantage as you want. As far as what the variants are there, again, you're seeing a growth in the BA2 12 variant. It's increasing steadily. It's not taking over quite as quickly as the original variant, the original BA2 did over Omicron, or what Omicron did to Delta. But it's sort of growing steadily, though. You can see between 4.2 and 5.14, it just jumps 10% or so each, 5 to 10% each week. And that's kind of where we are with that. So our recap. Case counts are still high again. It's high just about any which way around here. The Northeast, pretty much the entire Northeast. Not an increase over last week, so maybe that's a good sign of it's peaked. Don't know yet. A couple of days doesn't make a trend. The county, most of the state again high. Plenty of vaccine and testing capability. Second boosters for 50 or older, or less than 50 with comorbidities. No mask mandates or advisories other than the advisory to wear masks in town-owned property, which was the select board. That could be subject to change. That's where we are. I don't see a lot of towns or municipalities doing any mandates, perhaps some advisories. I don't know if that's going to change or not, but I don't see anything coming down from the state. It does say in areas that are high that you need to consider wearing a mask, so that is in the CDC guidance. Now, the state, last time the CDC set some guidelines, thought it was set the bar really difficult to achieve. And the state really hasn't discussed anything in our calls or whether they like what the CDC uses for the low, medium, and high. I posted on here and I posted on the website because it's all I've got right now to go for. And, you know, again, think of your own individual circumstances and your own risk tolerance levels, and make decisions based on that. I think I've said that the last few weeks now. I don't see mandates coming down anytime soon or at all. I think, you know, it's where we're at. So it's going to be, if anything, probably more towards advisories. You know, again, I could be wrong, but that's where we are. I haven't seen anything from the state that says we're going to go do anything otherwise right now. So that's what I have for an update for this week. And I plan on doing another one again next week. And hopefully we get another week of a good drop in numbers. And everybody take care. Thanks.